Okay, welcome back, class. This is Unit 13. This is the Alzheimer's unit. There are a lot of lectures on Alzheimer's. I think there's a total of 4 or 5 PowerPoints. So this one is just an introduction of what it is. Alzheimer's disease and dementia. It is Unit 13 in your book. So normal changes in the brain and nervous system due to aging. Nerve cell lost, nerve conduction slows, reflexes are slower, vision, hearing, taste, smell, and touch decrease, decreased blood flow to the brain, changes in sleep pattern, and the memory shortens with forgetfulness. Those are normal changes. Oops. Cognition is certain diseases affect the brain. Cognition is the ability to think clearly and logically. Changes in the brain affect cognitive function. Cognitive function has to do with focus and memory, thinking, reasoning, ability to understand, judgment, behavior, and self-awareness. Dementia is a more serious loss of mental abilities. It is loss of cognitive function that interferes with normal functioning with routine personal, social, and occupational activities. They may lose the ability to perform their activities of daily living. You need to know this. Dementia is a group of symptoms that often accompanies a disease or condition. Dementia is not a part of the normal aging process. Not everyone gets dementia. And it is not a disease itself. Dementia can be temporary or permanent. It is temporary if the changes have not occurred in the brain. When the cause is removed, so are the signs and symptoms. Pseudodementia is a reversible dementia. So when it's temporary, it could be because of drugs, interactions, anesthesia, emotional disorders, depression, metabolic and endocrine disorders. It affects when your blood sugars are way high or way low, or your kidneys aren't functioning, or your livers aren't functioning. Eyes and ears, hearing and vision, because all those things can affect your cognitive ability. And when those are fixed, it's a temporary dementia. Nutritional loss, dehydration, brain tumors, infections, arteriosclerotic changes, or more things. If they are fixed, the dementia will go away. Acute confusion is called delirium. Delirium occurs suddenly. It is usually temporary and is caused by infection, illness, injury, or drugs, and it is a medical emergency. Permanent causes of dementia would be Alzheimer's. Alzheimer's is the most common reason somebody gets dementia, but it's not the only reason. Vascular or multi-infarct dementia, it's somebody who's had several strokes. Lewy body dementia, Parkinson's disease, a lot of them get dementia. Sometimes at the end stages of AIDS, they get dementia. Huntington's disease, there's alcohol-induced dementia, and head injuries can cause dementia as well. The most common cause, like I said, is Alzheimer's, and the second most common is the vascular dementia, which is a multi-infarct, multiple strokes that cause disruption of the brain flow to areas of the brain, causing damage to brain tissue. Signs of dementia are short-term memory loss, personality changes, problems with common tasks, trouble finding names for familiar objects, getting lost in familiar routes, loss of interest in things they have previously enjoyed, poor judgment, difficulty performing tasks or learning new information. Diagnosis of dementia, they would establish that dementia is present by looking at the history, physical and neurological exam, blood test, CAT scan, MRI. Sometimes they can see the brain actually shrinking. Chest x-ray, cardio, and vascular workup. And that is the introduction to dementia.